In the U.S., vaccination rates vary widely from state to state. We're looking at Alaska and West Virginia sitting there with nearly 8% of their respective populations vaccinated fully. Yet Illinois and California, for example, they've got just over 3% of their population fully vaccinated. What's your take on why certain states in the U.S. are slower to roll out the vaccines than others?
Well, I've been working with the state of North Carolina in their Department of Health and Human Services, and what I've observed based on that is that certain states, they've never really done this level of deployment of a vaccine this quickly, and many of them were really not prepared to be able to do that. So they've put together rapid task forces, but really it's the last mile logistics that's problematic for many of these states. Especially getting to rural areas and the difficulty with the cold chain of distributing these vaccines. The Pfizer vaccine comes in a case of 969 vaccines, so you can't break it up to go to these smaller, more rural areas. And it's just challenging to be able to get out to all areas of the state, especially for patients who are not mobile and can't get out.
Mm. That's fair enough. In line with what we heard over at Davos, talking about vaccine distribution, that last mile of the delivery process being where the key bottleneck lies. I want to just take you back to a much earlier step in the supply chain, and that's the actual manufacturing of these vaccines, because the issue moving forward is going to increasingly be around a new generation of vaccines, booster shots that are going to be designed to address variants where there's some resistance to the vaccines we currently have. When are companies going to begin to shift their manufacturing supply, or when are they going to need to figure out when to shift their vaccine supply to produce new vaccines, boosters, relative to the vaccines that we're using currently?
Well, that's a great question, but unfortunately, I think we're even getting ahead of ourselves because right now they're not able to manufacture enough to even get the first shot of the current vaccine. One of the problems we have is something called the fill finish capacity. A fill finish line, which is a production line, can produce about 300 million vaccines per day. You really need two lines to do this 24/7, which is about 160 million vaccines per year, which is about 12 lines of capacity. There simply isn't enough capacity today. Nobody has 12 mRNA lines today available to produce that much. There's maybe 13 contract manufacturing organizations in the world that even have these production lines. About half of those are already being used for other life-saving drugs. So the problem is you can't take capacity from a life-saving drug to produce a vaccine. Yet we're just not able to produce enough as an industry to fulfill the demand that we need, even for the first doses within a year. As an industry, however, I know that everyone is working really hard to be able to produce this. They've done it in the past, and it's going to require additional funding. And if you look at the trade-off of governments losing $10 to $12 trillion so far, because of this pandemic versus a $5 billion investment perhaps to ramp up capacity, I think it's well worth it. And I think the industry is stepping up to ramp up capacity as quickly as they can.
Robert, how important is the private sector involvement in the distribution channels, and at which point of the process does it matter the most, or where can it make the biggest difference in your view?
So the private sector will play a big role here. I think up until now, it's been mainly through hospital networks. We're starting to see individual pharmacies beginning to be used. In the United States, at least, pharmacies are everywhere. They're in the smallest town in the country. So they really are a viable source for distribution and administering the vaccine to people. I think where we start to get into the difficulties is also, again, in that last mile distribution to all of these even private sector areas. The challenge is maintaining the vaccine at the right temperature all the way there, and making sure that it's handled properly. we've already seen some cases of waste, in some of these areas where people aren't trained, and there's a shelf life on the vaccine after it's taken out of its cold chain setting.